Okay, so this what happened. Look, I know it's about to be 7:15. All right, I know we usually do this at 7 o'clock. But I'm going to just be 100 with y'all. I just woke up from the meanest nap. And something about that alarm, it went in my ear in my dream and out my ear in my dreams. Because listen, I woke up, I was drooling. That nap was everything. But I'm ready for NCLEX Jeopardy. Are you? My bad. Please don't cuss me out. My bad. Okay? My bad. But we are here today. All right? Obviously, because we started late, we're still going to have our hour. Okay? We're still going to have our hour. I graduate LPN school on Sunday. Whoa! Ermani? I love that. Great job. Congratulations. Should I bring back my LPN pins? Should I bring these back? And should I make an LVN version? Let me know. I just scheduled for my NCLEX. The grass is probably at 5. Woohoo! When's your NCLEX, boo? All right, so, like I said, first of all, I am just refreshed from that nap. I'm so sorry. Gotta be top 3 naps all of 2022. All of 2022 gotta be top 3 naps. But okay, y'all saying yes. Okay, so yes to bringing it back, and yes to the LVN version, or y'all, which yes y'all doing? It's like I said, I need the LPN pin ASAP. Okay, the people have spoken. No problem. It is Elvin first, and so yes. Oh yeah, Cali and what's the other one? Texas. I don't know why. Cali in Texas had to be super, super extra. Like, people already talk shit about LPNs all the time. So I know people are like, what's the LVN? Like, it's just, why are you doing this to us? Why? Is it Billie Irish? That's a cute name. Thanks for all you do. Help me pass my NCLEX, start my new job in 2 6. Woohoo! Yay, congratulations. Awesome. All right, so I'm bringing it back and I'm doing the LVN. All right, so let's open our NCLEX Jeopardy for today. Anyway, hey y'all, hey. Happy Thursday. What's today? May 12th. I want to say 2 things. Y'all know I'm ADHD. 2 things. A, does anybody watch Married at First Sight? And if so, did anybody watch the decision day from yesterday's Married at First Sight? Please, did anybody watch it? That's the first thing. Second of all, NCLEX Jeopardy. What's up? Hey, I'm Nurse Sam. If you don't know me, how you doing? Welcome. If it's your first time, please let me know it's your first time so I can properly introduce myself and you properly introduce yourself to me. Put that it's your first time in the comments if it is. Paging Nurse. Oh my God. They must have paid them to all say yes. But okay, I'm not going to say that. We'll talk later. Okay? All right, so if this is your first time, or even if you're a repeat offender, this is NCLEX Jeopardy. It's basically a comprehensive NCLEX review. I wouldn't even say comprehensive. Comprehensive means fully. But it's an NCLEX review for RN, LPN, LVN, it does not matter. But yes, we play this wonderful, fun Jeopardy-style review game to help us aid through nursing school, but it's also very useful for NCLEX as well, obviously. I always tell people, if anybody DMs me, and I actually get the DM, if anybody says, hey, I'm just starting, what should I do to prepare? I'm like, come to NCLEX Jeopardy, period. A, is free every Thursday. And then B, it's just a great review, and you need to start preparing yourself for NCLEX style questions, testing from the get-go, because that's what your whole nursing school career, that's what you're going to be prepping for. So with this NCLEX Jeopardy, it's actually Jeopardy style. It's a blue screen. You have 5 categories. Our categories for today are pharmacology, pediatrics, mental health, fundamentals, and adult health / med surg. Okay, those are our topics. We have 5 questions per category, ranging from 100 points to 500 points. Hold on, let me go ahead and do that. Wait, let me exit out of that. I'm gonna show y'all the screen. Okay, so when you download the NurseSam app, it will literally show you, the mobile version of this. Hold on one second. Whoop, whoop, you see that? There you go. That is our Jeopardy setup. Okay, so that's where we're going to be playing. And like I said, when you download the free NurseSam app, you get access to our free NCLEX Jeopardy, and it changes every week, every Thursday. We do the same thing for ATITs, the entrance exam, but that's on Tuesdays. So I'm assuming that if you're here, you are either about to start nursing school, in nursing school, just graduated, like a couple people just said, and you're studying for the NCLEX. So that is why we do it. We do it for fun and prizes. Quick thing, today is the last day of Nurses Week, so our final deal of the day. First of all, we brought NCLEX Arcade back for today only, and it's actually the workbook and the videos. Okay, so usually before it was just the workbook, and if you wanted the videos, you had to go somewhere else, or sign up for the study bar membership. But for today only, we brought it back so you can get the full 372-page workbook, plus the 6 accompanying videos that's 18 hours of video review that we go through, and it's like arcade themed to once again make it fun. So that is, when you use code NW59, it's going to be $59 as opposed to $297, and less than 97, of course, obviously. So it's going to be $59 when you use code NW59. After today, we're taking it off the site, and it's going back in the vault for the study bar community, and only enrolled members of the study bar community will have the opportunity to play it, go through it in the future. So if you are not an enrolled member, but you still want to experience the fun that is NCLEX Arcade, I highly suggest you get on top of that before midnight. Okay, NW59, it's all over the site just in case you forget. All right, so like I said, the topics for today: pharm, peds, mental health, fundamentals, and med surg. Let's go ahead and hey, I'm going back up to everyone that said it's I'm going back up to what you guys are saying. First timer Chronicles of Nay. Hey Lauren. It's Suki. What's up? Healthy hair goals. What's up? Pretty girl G. Awesome. All right, Lauren said fundamentals for 500. Let's go. So let's go ahead and do it. Let me get my scoreboard out. Y'all know we play for points. So quick little rundown for the people that are new, that's never been here. I'm going to read the question. I'm going to read the answer choices. All right, because this is Jeopardy style. Y'all know y'all have to say what is. Okay, so it is multiple choice, 1, 2, 3, or 4. So you're going to say what is, and then whatever the answer is, 1, 2, 3, or 4. First person on my screen, because sometimes it lags because of the internet connection. Maybe mine or yours is strong. Hey, I'm not knocking nobody. It might be my internet. Who knows? But just in case there's a lag and what you see on your screen is different from what I see on my screen, I can't see your screen. I can only see mine. So that's the one I'm going to go by. But like I said, once again, we're playing for prizes, and it's a fun thing. And it's like a group study group that we do every week. So even if you don't get it first, as long as you're getting it correct, you know, that's obviously the point. Okay? But if you do answer first and you're you do answer first and you answer correctly, then you're going to get those points. The winner with the highest amount of points is either going to get a free Ultimate Nursing School bundle, or if you have it already, you're going to get a free Nurse Life planner. I just had the pen. I lose this pen every time. Sorry. And the little gold pen with the little diamond on the top. And it comes with a free First Slate Kit palette as well. So those are going to be the prizes for today. If y'all are ready, we're starting off with Fundamentals 500. Give me a thumbs up if you are ready to go. thumbs up if you're ready to go. Tag anybody that may need an NCLEX review. Maybe they're about to take their NCLEX. Maybe they're in whatever semester of nursing school. Either way, they're going to need this review. It's super fun and it's free. So tag whoever you need to tag. And if y'all are ready, give me thumbs up. All right, I'm seeing some thumbs. So let's go ahead and get started. Let's get it started. Let's get it started in here. All right, let's go. That nap did everything for me. Woo! All right, so fundamentals for 500. The nurse is assigned to care for a client who is experiencing episodes of postural hypotension. Which action should the nurse take to ensure safety while transferring the client from the bed to the chair? Is it 1, arrange for a transfer board to be used? 2, perform the transfer using a hydraulic lift only? 3, put the client's shoes on so that the client will not slip on the floor during the transfer? Or 4, allow the client to dangle the legs in a sitting position on the bed before transfer to a chair? Well, I pray all y'all get this, because I guarantee you this is going to be on your NCLEX. I guarantee, in some way, shape, or form. Ooh, that's what I love to see. That is what I love to see. Let me see what the answer is, because I'll be mad if all of us wrong. Okay, good. All right, awesome. Cool. I just want to make sure. So, anybody need to read it again? Looks like everyone has the same answer, which is the correct answer. Congratulations. The correct answer is what is 4. Dangle them legs. Dangle them legs. Okay? So it says, having the client sit on the side of the bed before transfer allows the body to adjust to position changes. Okay? Remember, back it says that we're caring for a client who's experiencing episodes of postural hypotension. All right. Whenever you have a client that is experiencing postural hypertension, it means that their blood pressure is experiencing drops. Well, they're experiencing drops in their blood pressure whenever they're changing. I'm gonna say posture. Whenever they're changing their posture. So from lying to sitting and from sitting to standing, that change in position, the BP drops, and we all know one of the main dangers of having hypotension, especially hypotension, you stand up too fast. Sometimes you even experience it without having postural like that actual diagnosis. Sometimes you just stand up too fast and you're just like, ooh, whew, I was almost laid out, okay? That BP drops, okay? And we all know that when it comes to hypotension, blood pressure, and safety, NCLEX loves it. Okay, the theme of the NCLEX is always client safety. So a lot of the questions obviously are geared toward making sure you know what to do as far as making sure that not only are you safe, but your patient is safe as well. So the action that the nurse should take to ensure safety for that client while they're transferring them from the bed to the chair is, once again, to allow the client to dangle the legs in a sitting position on the bed before the transfer. Okay. It says the nurse should remain with the client and assist in the transfer to the chair. All right. Don't just have them dangle there and be like, all right, get up. No, you have to assist them as well, just to make sure. As far as the other options, arrange for a transfer board to be used and perform the transfer using a hydraulic lift, those are not necessary. That's actually it's just not necessary. And then, it says, number 3, it says, put the client's shoes on so the client will not slip on the floor during the transfer. Although that is a safety measure, it's an important safety measure, it's not related to preventing any of the injuries that can happen related to postural hypotension. If they would have been like, I don't even know. That's putting on their shoes so that they won't slip on the floor and putting on like non-skid socks or something like that. That's just a general safety measure, but specific to this question, postural hypotension. That's why it's dangling, just to make sure they kind of get their bearings and their blood pressure in their body can adjust right before the transfer, so they don't have a drop and then they drop. If your BP drops, you're gonna drop too. All right, let's see first person to get that. It looks like everybody got that answer. Thank God. Great. All right, first person to get that was Sina, or is it Sina? I'm not sure. CNA, I'm not sure. Sienna. Girl, please tell me how to pronounce your name. Please. I'm gonna call you Nay. Hey, Nay, with 3 E's. Okay, good. Awesome job. You are on the scoreboard with 500 points. Just come out swinging. Just because, like I said, just because you're not the first person to get the points, as long as we are getting these correct answers, that's all I care about. That's all I care about, okay? So great job, Nay. Great job, Bentakib. I see what it's for. Ermani, Jashana, The Gracias Party of 5, Snowcake 16, It's Suki, baby. Don't forget to say what is Suki. Pure Buyout, Deja, yep, I think so. Deja, Cover Girl, Chronicles of Nay, Kiss My Dimples. Oh, I see you say what it's for. Everybody Loves Joey. Hey, Brand Avenue, if you're still here. I will answer you in just a second, Nene. But made the Bundle Kids bomb covers. Oh, thank you, Lauren. I think, yeah, you can call me Nay. Okay, awesome. Great job, Nay. Deja, awesome. Great job to everyone that said what it's for, which was literally everybody. So, great job. Awesome. I just want to make sure we all kind of understand that. And from the looks of it, because they all got it right, you do. So, great job. All right. No, Lauren, I didn't see you. I did not see your answer. If for some reason, if I called up everyone's names and you weren't there, I don't know why I didn't see your answer. You may have to like exit the live and then come back in to kind of like reset it. Yeah, I didn't see your answer. All right, so let's go ahead and do another one. Let's do farm. Oh my gosh, this one is so easy. This one is so, Teddy Bear said one. It's okay. It is okay. But now you know why the answer is 4. Teddy, now you know why the answer is 4. All right, so this one's another freebie. This one's a super freebie, okay? All right, this is pharmacology for 300. I wish this was a question on my NCLEX. All right, so pharm for 300. A client has an as-needed prescription for ondansetron. For which condition should the nurse administer this medication? 1. Paralytic ileus. 2. Incisional pain. 3. Urinary retention. Or 4. Nausea and vomiting. A client has an as-needed or PRN prescription for ondansetron. For which condition should the nurse administer this medication? Is it 1. Paralytic ileus. 2. Incisional pain. 3. Urinary retention. Or 4. Nausea and vomiting. This is probably easy for me because I ate these like Skittles last year. Woo-wee! All right, getting everyone's answers in. Once again, the PRN prescription is ondansetron. For which condition should the nurse administer this medication? All right, paralytic ileus, incisional pain, urinary retention, or nausea and vomiting. Let's see what our answer is. What is 4? Oh, 4 is the last one too. Great. What is for nausea and vomiting? All right. Ondansetron, that is the generic. What is the brand name for ondansetron? Zudran, Lauren. Zodran. I know what you meant. Zofran. Yes, the brand name for ondansetron is Zofran. Absolutely. Now, know this, on your NCLEX, you're only going to get generic names. You are not going to get brand name nothing. Okay, but in real life, you're more than likely just going to refer to everything as the brand name. So learn both. Be familiar with both, because obviously right after taking your test, you're going to get into the real world. And I don't want you to be like, you know, maybe at someone's hospital, doctor's office, wherever you're going to work, you know, struggling when someone's, you know, saying brand names and you're like, wait, what's the generic for that? And then plus it's easier for patient education just to tell them the brand name, because that's most likely what they either hear on TV, you know, those commercials, or they're just more familiar with brand names. But once again, for the NCLEX, to be familiar with the generic as well, because that's all you're going to see on the NCLEX. All right, so ondansetron is the generic for brand name Zofran, and that is used for nausea and vomiting. All right, it says ondansetron is an anti-emetic, anti-nausea. Remember, emetic means like emesis, which is, I almost said throw up, vomiting. So anti-vomiting, anti-emetic. It's used to treat post-op nausea and vomiting, as well as just nausea and vomiting associated with chemotherapy. All the other options are incorrect. That's just not what you give ondansetron for or Zofran for. Okay, first person to get that, I think, was Lauren. Hold on, let me go back up. Yep. Awesome job, Lauren. Even though you said Zodran, I saw that. All right, so Lauren, you're on the scoreboard with 300 points. Let me call out all my boos that got it correct, even though they weren't first. But on the NCLEX, you would have got it correct. So, what is 4? So great job, Lauren. I am K. Remember to say what is. It's Suki Baby, London Lauren. Oh, I was like Lauren London. My bad. London Lauren. The Garcias. Did I say the Gracias? I'm dyslexic as hell. The Garcias, Jashana, Shanford, Day, Mrs. 010716, Kiss My Dimples, Ermani, Bentakib, and yes, we were talking about the Zofran. So Danisita, great job. Lauren, even though you said Zodran, I know what you meant. Great job, Chronicles of Nay. I got your answer. What is SIFs? IMK. What's SIFs? Now I'm just hitting everyone that said Zofran. God, great job. Hey, Vanas, how you doing? Nicole 2K3, awesome job. Oh, okay? So Lauren wants me to give the point to the next person. Hold on, let me see who else, who got it. Lauren's won literally everything, but she would just be here to support. I love you, Lauren. Okay, so next person who said what is, Kay, it would have been you, but you got to say what is. Next person to say that was Itsuki Baby. So, all right, Itsuki Baby. Lauren donated her point to the next person, so it is you. Great job. Itsuki Baby, you on the scoreboard with 300 points. I can't type today. All right, great job. That was farm for 300. Let's go ahead and do mental health for 400. All right, so mental health for 400. The nurse monitors a client diagnosed with anorexia nervosa, understanding that the client manages anxiety by which action? 1. Engaging in self-mutilating acts. 2. Observing rigid rules and regulations. 3. Always reverting to the independent role. Or 4. Constantly striving to avoid making decisions. Let me read that one more time. The nurse monitors a client diagnosed with anorexia nervosa, understanding that the client manages anxiety by which action? 1. Engaging in self-mutilating acts. 2. Observing rigid rules and regulations. 3. Always reverting to the independent role. Or 4. Constantly striving to avoid making decisions. What is our answer? Back up. All right, so our answer for that one, please scroll back up. First, I changed my mind. What is 2? All right, the correct answer is, what is 2? Observing rigid rules and regulations. What is 2? Let's see who got that first. Bentikib. Hey, boo, hey, great job. All right, Bentikib, you're on the scoreboard with 400 points. Who else got what is 2? NC Pink Rose, great job. Deja, awesome. The Garcias, Lauren, Crafty, Mrs. Devo, Tori, Sosa. What? No, it was 2, Lauren. It was 2, observing rigid rules and regulations. So you got it right. Okay, great. So it says, clients with anorexia nervosa have the desire to please others. They're chronic people pleasers. Rules and rituals help them manage their anxiety. Their need to be correct or perfect interferes with rational decision-making processes. These clients generally don't engage in self-mutilation. All right, so does that make sense? So it wasn't 1 as far as self-mutilating acts. That's typically not what clients with anorexia nervosa do. Always reverting to the independent role. Because they're people pleasers, they'd actually be reverting to the dependent role. And then constantly striving to avoid making decisions. That one's not accurate as well. Because it's not necessarily that they're striving to avoid making decisions. They're just striving to make the perfect decisions, if that makes sense. And because they want to be perfect and people pleasers, they want to make sure they're following all the rules and doing everything to the T. Yeah, Cassandra, you here? All right. So once again, the answer is what is 2, observing rigid rules and regulations. Okay, Bentikib got that, but great job to everyone else that got what is 2. Let's go ahead and move on. Let's do some med surge. What time is it? Let's do 400. Ooh, all right. We're in med surge, guys. The nurse is, this is med surge / adult health for 400. The nurse is caring for a client on a mechanical ventilator who has a nasogastric tube in place, or NG tube. The nurse is assessing the pH of the gastric aspirate and notes that the pH is 4.5. Based on this finding, the nurse should take which action? 1, document the findings. 2, reassess the pH in 4 hours. 3, instill 30 milliliters of sterile water. Or 4, administer a dose of a prescribed antacid. I'm going to run it back. The nurse is caring for a client on a mechanical ventilator who has a nasogastric tube in place. The nurse is assessing the pH of the gastric aspirate and notes that the pH is 4.5. Based on this finding, the nurse should take which action? 1, document the findings. 2, reassess the pH in 4 hours. 3, instill 30 milliliters of sterile water. Or 4, administer a dose of a prescribed antacid. What is our answer? All right, make sure you guys are understanding what the question is asking. All right. Scrolling up. Giving y'all some time to answer. All right, so the answer is, what is 4? Administer a dose of a prescribed antacid. Administer a dose of a prescribed antacid. That is the correct answer. First person to get what is 4, we're going to go over it. First person to get what is 4 is it you, Teddy? Scroll. Yep. Teddy Burlove, what's up? Congratulations. You are on the scoreboard with 400. Teddy Burlove. 400 points. Awesome job. All right, quick little rundown on the scoreboard. Nay has 500. Bentakib and Teddy have 400. And Itsuki Baby has 300. It can still be anybody's game. We still have like 30 minutes. All right, who else got what is 4? Itsuki Baby, awesome job. London Lauren. The other Lauren. Tori Sosa. I wish I hadn't doubted it. Right, don't doubt yourself. Y'all know this. Okay, so let's go over. A lot of people either said 1 or 2. So let's go ahead and go over the actual rationale. So just in case you see this again, something similar, get a question about NG tube, gastric pH, you'll know what to do. So it says the client on a mechanical ventilator who has a nasogastric tube in place should have the gastric pH monitored at the beginning of each shift or at least every 12 hours. Write that down if you didn't know that, okay? Because of the risk of stress ulcer formation, all right, a pH lower than 5, which would be acidic, should be treated with a prescribed antacid. Right there, okay? Now, if there is no prescription for the antacid, the primary healthcare provider should be notified, okay? It says documentation of the findings should be done after the administration of an antacid. Make sure it's prescribed, PRN, whatever it is. And then it says still water installation is not an appropriate treatment, okay? It's not gonna do nothing to the pH. It's not gonna dilute it. It's not. So yes, if that pH was 4.5, and we know that pH is lower than 5 would be acidic. So that would mean that the where the nasogastric tube is, the gastric aspirate or the gastric contents, it's really acidic in there. And we know that with the really acidic gastric contents, that can once again cause stress ulcer formation or just ulcer formation just in general. That just increases the risk of ulcer formation. So we're just going to give them an antacid to help combat that acidity. Does that make sense? All right. I'm in level 1, so this is very informative. Awesome. That's the whole point. That's exactly why we do this. So when you get to level 2, 3, or wherever, you'll be like, I did this when I was in level 1. This is child's play. Okay? All right. So great job to everyone that got that one. And if you didn't, we went over it so that now you know, because it's my super short show. I don't know if y'all remember that. I might be old. Let's do peds for let's do peds for 200. All right, so the nurse is caring for an infant with a diagnosis of congenital heart disease. Which finding on physical assessment does the nurse attribute to chronic hypoxia? I actually learned this from a Grey's Anatomy episode. So, 1, tachypnea. 2, tachycardia. 3, sucking on the fingers. Or 4, clubbing of the fingers. My connection to this video is terrible. I'm so sad right now. Oh no, why? Do you have to leave? Lauren, try leaving. Or London Lauren, try leaving and then coming back. I have to make sure I was connected to the internet. I'm gonna say it one more time. We have, the nurse is caring for an infant with a diagnosis of congenital heart disease. Which finding on physical assessment does the nurse attribute to chronic hypoxia? 1, tachypnea. 2, tachycardia. 3, sucking on the fingers. Or 4, clubbing of the fingers. What is that answer? Like I said, I know this from a Grey's Anatomy episode. Is anybody else a Grey's Anatomy head? And do y'all know what episode I'm talking about? If not, we'll talk about it in a second. All right, I'm going to give y'all some time to answer. Let me scroll up. Jersey. All right, so the answer is, what is 4? Are all the answers what is 4? If this was an actual test, I would have anxiety about how many 4s is in a row. But yes, it is what is 4. Clubbing of the fingers. Clubbing of the fingers. All right. It says the child with congenital heart disease may develop clubbing of the fingers. And clubbing of the fingers is thought to be caused by anoxia or poor oxygenation. All right. That's like when the, hold on. I'm going to attempt to draw a clubbed finger. Don't judge me. And that's like the nail. That's like the knuckle. Just wanted to make sure it didn't look like a penis. Okay, cool. It doesn't, right? It doesn't look like a penis. That's a finger, y'all. That's like y'all know what this means. It's a finger. All right, so that is our clubbed finger. All right, so that's what it means when we say like clubbing of the fingers. It literally looks like a club at the end. Okay, the tips are clubbed, and that's due to poor oxygenation. It says tachypnea and tachycardia are signs of acute hypoxia, and sucking on the fingers may indicate like hunger or irritability, but sucking on the fingers definitely does not attribute to chronic hypoxia. Lauren, get out. Lauren has to leave because she is misbehaving, and I'm not going to deal with it. Lauren said look like Jesse Williams. I'm not doing this with you. Like, that's funny. Is clubbed like code? Yes. Wait, oh, contracted or more curved. It's like like a curvature. Yeah, it's like a curvature, and that's, like I said, it's due to the poor oxygenation. Hold on, I'm gonna go to it. Who said which episode you used to watch Grey's every day? So you know the episode, as far as the episode of Grey's, remember when Yang and Burke, I think they went on their first date. And they went to like some restaurant or so. I think it was Valentine's Day, who knows. They went to a restaurant, and one of the guys like passed out on the floor, and they was like, oh my God, he has, I forgot what the disease was. But she like picked up his hand, and she was like clubbing of the fingers, and it was like heart something. Poor, he's not getting enough oxygen. Do you remember what I'm talking about? And Burke thought that like the date was ruined, and then Yang was like, are you serious? That was the best date ever. Let me know if you know what I'm talking about, Nay. All right, so let's see who the first person is to get that answer. And no, it's not Jesse Williams' leg. Third one, it's not. So what it's for, first person to get that was Unknown Beauty. Hey, boo. Hey, boo. Unknown Beauty, welcome back. So Unknown Beauty, you have 200 points on the scoreboard. Who else got what is for? Bentakib, awesome job. Chronicles of Nay, Crafty, Lauren, Tiana, IMK, Holly Dreyer. Do you have any notes for mentors too? Within the Ultimate Nursing School bundle. Let me see if I answered that question. So it could be like a penis with baby. I'm not doing this with y'all. Teddy, you're also bad. Perfect. All right. Great job. Hold on. Next question. Let's do, have I done everything? Yeah, I did all, yeah, I've done 5. Okay, so let's reset and let's go back to fundamentals. Let's do, oh, this is a good one. Fundamentals. Oh, I didn't see you, Suki. See, that's what I mean. Well, I'm glad you answered 4. You and Jesus know. I couldn't see it, but at least I know you answered 4. But it didn't pop up on my screen for some reason. First of all, quick question. Actually, no, I'm not gonna say that. Yeah, I'm gonna say, would y'all be interested? Outside of our weekly Thursday, NCLEX Jeopardy. Like I said, I do that for free, for about an hour right here on Instagram Live. But like I said, sometimes it's like a connectivity issue, and that can be annoying. Would you guys be interested in actually not on a Thursday, but coming to a scheduled Zoom or webinar or whatever, where we're doing the full 25 questions and y'all can see it, and it's an actually secure webinar, and not on live. So you'll be able to see the screen, see the questions, and see me as well. I'll just be reading it, but you'll be able to see it. Would y'all be interested in doing one of those? Okay, but I couldn't even get it out. Bitty Kid said yes. Ooh, not with the caps. Okay, bet. Where's my sticky notes? Okay, cool. July said what is yes. Okay, cool. Noted. Pretty much, but it'll well, I don't have Kahoot. I have literally Jeopardy. So what you see is my Jeopardy. It's basically the same thing as Kahoot, but we're just gonna see my game of Jeopardy. And you'll be a share screen type thing. It will be an actual webinar. We'll all be in a room, and we'll go literally through all the questions. Whenever I do that, it's about a 2-hour thing, because when we do it for an hour, we get through about 5 questions. So, right. Okay, cool. I'm glad y'all are fans. Okay, awesome. I will make that happen. I'm gonna try to aim for next week. What's today, Thursday? I'm gonna try to aim for next week, but make sure y'all follow my post or sign up for my emails, because I'm gonna send it out that way and make sure let y'all know so y'all can sign up. Cool. Okay, great. That's cool. All right, so let's go ahead and get back to this one, but now I know for next time. Is it bad if someone... Y'all can get him. I won't. I'm not even gonna do it. Y'all can get him if y'all want. I'm gonna go back to this question. Fundamentals for 400. The people on this app, I swear. To detect the development of a chronic carrier state in a client with hepatitis. Stop making me laugh. To detect the development of a chronic carrier state in a client with hepatitis, which laboratory tests should the nurse assess? 1, hepatitis B virus DNA. 2, prolonged prothrombin time. 3, hepatitis B surface antigen. Or 4, antibody to surface antigen, or anti-HBs. I feel like y'all need to see this. I feel like y'all need to see this question. Hold on. 1 second. I'm about to show y'all right now. All right. So once again, to detect the development of a chronic carrier state in a client with hepatitis, which laboratory test should the nurse assess? These are the options right here. 1, hepatitis B virus DNA. 2, prolonged prothrombin time, or PT. 3, hepatitis B surface antigen, or this little thing right here. Or 4, antibody to surface antigen. All right, so make sure all y'all got this. You can see it. Okay, cool. actually don't know this answer. What would it be? Let me put my answer in my head. I'm going to say 4. I'm going to say 4 just because I'm guessing. It's between 3 and 4, I think. Damn, it's 3. The answer is what is 3? Damn, I would have got that wrong. Ooh, that's annoying. So yes, the answer is 3. Hepatitis B surface antigen. I don't know about y'all. I get antigens and antibodies mixed up all the time. Do you guys? Do y'all know the difference between an antibody and an antigen? It's a serious question. Anyway, the answer is what is 3. Hold on, because I know a bunch of y'all got that because y'all got this. Okay, let me go back up. Not as far up as Mr. Can Giraffes Smell Their Own Farts? What is 3? I think the first person to get it was Unknown Beauty. What's up, boo? Okay, I done lost my... I'm back. All right, Unknown Beauty, you were on the scoreboard with 200 points, but you just answered that one first, so you got another 400 points, making you have a total of 600 points. I really need to do my live event in Atlanta. That'll be really fun. Plus 400, yeah, so you have 600 points. Awesome job. Who else got what is 3? Not me. I'm not calling my name at all. I would have got it wrong. It's Suki Baby, awesome job. Teddy Bear Love, Nay, Ermani, Deja. It's just EMC with a 3 question mark. No, it's 3 exclamation point. You knew the answer. You got this, boo. Blackberry, July. Who else? I know I was going with 4 too, girl. Mrs. Botello, I Am K, Kiss My Dimples, Immaculate Michelle. Oh, I thought I said Mario Kart. Money Kith Kart. Awesome job. Yeah, I saw you put 3 first and switched to 4. What I told y'all. Y'all, do I need to repost my Jocelyn? Y'all know I love Jocelyn for some reason. Y'all know I love my Jocelyn nurse references. But yeah, I put a video talking about how you should not second guess yourself or doubt your answers when you know in your gut what it is. You know in your gut what it is. Just go with your gut. Hold on, I think someone, it says, Kitty said the antigen basically is, it helps to go with it. It works with it. It basically mimics something. It's limiting what it's doing or what it's enhancing, I believe. Trust me, I'm not going to come for you. Lauren says antibodies fight and antigens fight. So I was like, run the DNA test. Right. I was definitely stuck between antigen and antibody. Right. Okay, so let's go ahead and look it up together. Well, first, let's go ahead and read the rationale. Then we're going to look up the difference between antibody and antigen, because ain't nobody got time for that. So it said the, what is 3, which was hepatitis B surface antigen, that says it's present in chronic carriers. Hepatitis B virus DNA, which is the first one, indicates viral replication. That makes sense. A prolonged prothrombin time is caused by decreased absorption of what vitamin? Y'all know about PT, right? Prothrombin. All right, so a prolonged prothrombin time is caused by a decrease of the, a decreased absorption of which vitamin in the intestine? Do y'all know? We're just real quick. Okay, money cart. Vitamin K, absolutely. Vitamin K. You go, NC Pink Rose. You go. So great job, money cart. Great job to NC Pink Rose. Great job, it's Suki Baby. Yes. It says a prolonged prothrombin time is caused by decreased absorption of vitamin K in the intestine with decreased production of prothrombin by the liver. And then it says anti-hepatitis B, which is the antibody to surface antigen. That is a marker for the response to the vaccine and indicates immunity to hepatitis B. Now let's go ahead and look up antibody and antigen. Y'all know me and Google are right here. I never claim to know all the answers. If I really don't know something, I will say, girl, I do not know, but let's figure it out. Let's literally look it up together. All right, so let's go. Antibody versus antigen. All right, here we go. Is there some, y'all know I need my pictures. Okay, great. I went straight to images. Nishaniki, thank you so much. It's in my shop if you want it. All right, so antibodies versus antigens. Okay, this was a good one. It says an antibody is a protein produced by the immune system in response to the presence of an antigen. All right, so hold on. All right, so antibodies are made based on antigens. Does that make sense to y'all? Does that make sense to y'all? I'm gonna show y'all a good visual. Hold on one second. I done lost the, where'd it go? Okay, here we go. This is a good visual. All right, hold on one second. I'm so glad you made it, Cass. Okay, so who's Cassandra? Because I didn't see your name pop up twice. I gotta introduce myself. What's up? Hey, how you doing? Welcome. All right, so this is the antibody versus antigen visual. All right, so an antibody, this little Y here, that's a protein, and it's produced by the immune system in response to the presence of antigens. So these antibodies are made specifically, made specific to the antigen. Does that make sense? Wait, let me see what you said. So the stronger or harsher the disease, the more antibody it takes to fight it. I don't know if it has to do with the quantity of antibodies. I think it's probably based on the amount of antigens that's probably on whatever what that's present, but I'm wondering if it's like a quantity or quality thing. It said, and then Nay said you have to be exposed to an antigen for your immune system to fight it off, and once your body fights it off, antibodies are produced. Oh my gosh, I saw a really cool video. Hold on, let me see if I can find it. Ooh, hold on. This is so funny that this is happening because earlier today, right before I went on my epic nap, I saw, I was on Instagram and I saw someone they were doing almost like a skit. They were almost like doing a skit about antigens and antibodies, and I totally forgot. Hold on, let me see if well, it was about white blood cells. Hold on, we're gonna watch it together. Hold on. Toxins are released. Antitoxins. There's too much antitoxin, antigen, antibodies. There's a lot. All right. Y'all saw that? Isn't that kind of cool? I mean, they were talking about white blood cells and pathogens and stuff like that, but similar. I think Nay's explanation was the best. You have to be exposed to an antigen for your immune system to fight it off, and once your body fights it off, antibodies are produced. So that's basically why there was like, people was like, oh, get the vaccine for COVID versus once you get COVID, then you'll have the antibodies, then you won't need the vaccine. That's what I thought about. I don't know if that's true or not, but yeah. But that was a cool little thing. Okay, let's go back to NCLEX Jeopardy. But y'all know this is a whole group setting teaching thing, so we all gonna learn today. All right, so that was a good one. We all learned something. Antigen versus antibody. Go back here. Okay, perfect. So let's go back. Let's do... That's what I thought too. I have no idea if that's true or not. Y'all, I don't know. I think I said I don't know if that's true. And I don't want to spread no false information. I don't feel like having a CDC on my door. Now, Teddy, I would have been so mad. All right, so let's do... We did fundamentals, and then I think we did pharmacology next. Let's do... Farm. Let's do farm. What the fuck? Absolutely not. Not that one. Ooh, wait, maybe. All right, let's do this one. Because this is a... Okay, let's do this one. Let's do it together. We're going to learn something today. All right, guys. I feel like y'all have to see it. Listen, I hate reading. All right. So this is Farm for 500. A client diagnosed with depression and prescribed tranylcypromine sulfate. And I know y'all impressed by that pronunciation, but okay. But yes, prescribed tranylcypromine sulfate has been instructed on the appropriate diet. The nurse determines that the client understands the diet if which foods are selected from the dietary menu. All right, 1, pickled herring, gross. French fries and milk. 2, pepperoni pizza, salad, and a cola drink. 3, roasted chicken, roasted potatoes, and a beer. Or 4, fried haddock, baked potato, and a cola drink. What is our answer? Nate said, what is, I don't know. Girl, same. That's what I was like, let's do it together. We're going to learn. Can you imagine, like, I skip this question, and it's like your first question on NCLEX? Ooh, y'all would cuss me out. Y'all would cuss me now. I say, I'm going to choose, wait, hold on. Let's read it again. A client diagnosed with depression and prescribed tranylcypromine sulfate has, okay, so obviously an antidepressant, but what kind of antidepressant? Has been instructed on the appropriate diet. The nurse determines that the client understands the diet. All right, so we're looking for the correct diet. The client determines the nurse determines that the client understands the diet if which foods are selected from the dietary menu. 1, pickled herring, French fries, and milk. 2, pepperoni pizza, salad, and a cola drink. 3, roasted chicken, roasted potatoes, and a beer. Or 4, fried haddock, baked potato, and a cola drink. What is that? Y'all saying I don't know. Now y'all know y'all cannot say I don't know on the NCLEX. Give it your best guess, because even, okay, secretly, I really don't know what the hell this is. So, but we're going to guess together. We're going to put our best foot forward and choose an answer. All right, so we're looking for the diet that would be prescribed to a client with depression who has also been prescribed what? Damn it, I was just talking shit too. Tranylcypromine sulfate. All right, I don't know what that is. It's a antidepressant, but I don't know what class. So what is it about these diets that's important? Let's look and see what y'all saying. That's what I thought. So is it 3? Right, I was looking at the beer. Okay, let's look and see what the answer is. Y'all ready? Damn it. Damn it. Oh. All right. This is a good one. This is a good one. Ooh. Don't do me. Don't do me everything, Ari. Don't do me everything out. Wow. Wow. I was like, yeah, get a beer. See, that's why I said make sure you understand the question, because even when I was like, okay, we're looking for the right answer, in my mind, I was like, okay, which diet are we telling them not to do? And I was like, okay, I see beer. So is that the only answer? Because everything else looks fine. I don't know. Beer was the only thing that stood out to me, which is why I was like, maybe it's going to be what is 3. Wow. All right, let's get into what this actually means. The beer definitely got me. Partly because I half want a beer right now. But okay. All right, so tranylcypromine sulfate. All right, that is a monoamine oxidase inhibitor, or an MAOI. All right, and that is used to treat depression. A tyramine restricted diet. I'm so mad at myself. I can't even. I don't know where it is right now. All right. A tyramine restricted diet is required while on this medication to avoid hypertensive crisis, which is a life-threatening effect of the medication. All right. Remember, with MAOIs, I have a whole thing. I have a whole study kit on this. Like, shame on me. Nurse Eats, if y'all want to look into the diets and stuff like that. But yeah, crazy girl. A tyramine restricted diet. All right, while you're on MAOIs, you're not supposed to eat foods that are rich in tyramine. All right, now, what foods have tyramine in it, you ask? Girl, I'm about to tell you right now. So it says foods to be avoided are meats prepared with tenderizer, smoked or pickled fish, beef or chicken liver, and dry sausage, which is salami, pepperoni, bologna. Gotcha. Okay, great. In addition, figs, bananas, aged cheese, yogurt, sour cream, beer, red wine, and other alcoholic beverages, soy sauce, yeast extract, chocolate, caffeine. So nothing that will bring them joy. Oh, gotcha. And aged, pickled, fermented, or smoked foods, they all need to be avoided. Don't put me on it. Do you want me to be further into depression or out? Like, I need to know. Damn, no chocolate, no caffeine. Ooh, that's crazy. But yes, those are the foods that you want to avoid because they are rich in tyramine. And if you're on an MAOI or an MAO inhibitor, which is used to treat depression, you want to avoid tyramine rich foods. So a tyramine restricted diet is required. So one was pickled herring. From there we can stop because pickled. Teddy said, so water. I was going to say ice. And then, oh my God. Then I was going to say, so y'all know that line from Devil Wears Prada. And she was like, I'm just going to just eat ice. And when I feel faint, I'm going to eat a block of cheese. She can't even do that because you can't do aged cheese. Jeez. The worst. So yeah, pickled herring. Already that's out because pickled, remember anything aged, pickled, or fermented or smoked foods, they need to be avoided. So one's out because of that pickled herring. What is a herring? Is that a chicken? I don't know. 2, pepperoni pizza. Already out because pepperoni. All right, remember dry sausage like salami, pepperoni, and bologna. All right. So 2 is out. 3 was roasted chicken, roasted potatoes, and beer. I forgot your name, but she came for all of us that said beer. It was like, who's going to encourage a client to drink beer? Actually, that's just really in like nursing homes, honestly. Have y'all ever seen like a doctor, like actually they'll have an order for them to have 1 glass of red wine a night? I have. It confused me and I wanted the same prescription, but okay. But yes, alcoholic beverages in general should be avoided because, once again, high in tyramine, and that's what you should avoid while doing MAO inhibitors. So the answer just left the number 4, fried haddock, baked potato, and a cola drink. It should have said diet cola and then maybe, or caffeine-free cola, and then maybe in my mind I would have chose not to do that. But number 4 still says cola drink. Did that confuse y'all too? But I'm sorry, this is NCLEX. That's probably the most correct answer out of all of them. You see why we do these practices? That everything, all right, that was this. NCLEX world, no, right. So, absolutely. There we go. I've seen it. Beer as desired once a week. Right. Could you split my points with everyone on the board? I have to exit the live because I'm driving. Okay, well, definitely drive safe. Thank you so much for joining, Nay. You did great. You would have 500 points. So I'll go ahead and disperse those. Thank you so much for playing. Come and visit us next week. I won't take a nap right before live and then sleep into it. So sorry. Herring is fish. Oh, okay, cool. Ew. All right, let me look. The caffeine threw me off. Yeah, so that would be the right one. The fried haddock, baked potato, and a cola drink. All right, awesome job. All right, that was a good one. Wait, who got it? Did I say who got that? No. I'm gonna go up and say and see who got that one first. I have to scroll all the way the hell up. One second. Was it? Oh, no, I'm not sure. I'm scrolling all the way up. Everything, Ari, it would have been you, but you didn't say what is. Ermani was actually the first person that actually said what is. But everything Ari said it first, but she just didn't say what is. So Ermani, you are on the scoreboard. Manahi. Awesome job with 400 points. Okay, so Nay wanted us to 1, 2, 3, 4, 5 split her points, so everyone gets an additional 100 points. So Itsuki Baby now has 400. Benta Kib now has 500. Teddy Bird Love now has 500. Unknown Beauty has 700. And Ermani, you had 400, so now you're gonna get another 100. So now you have 500. So it is Unknown Beauty. Whew, that is in the lead. Y'all want to do one more? I'm gonna scroll. Let me call all my what is fours. Who else got it? Benta Kib, Diamond Alexia. Well, come back. Diamond Alexia. What is now? I'm hungry. Y'all are funny. Benta Kib, oh my gosh, that's so funny. You said I kept putting 4, but you mean what is 3. You should have just kept it as 4. Awesome. Yep. So I called out everybody that got what is 4. But yeah, y'all want to do one more? 2 more. All right, come on. Let's go ahead and do one more. Is Lauren still on? Girl, guess what I forgot to do? First of all, I just told y'all that I woke up from a mean nap. So I scrambled and got my computer, and I did not bring my laptop charger. But I have one right here with me. So that's going to sustain us for our next, 2 questions. All right, let's do another question. What was that? I do not remember what kind of question that was. I can't remember. So let's just go ahead and go to... let's go to maybe peds. Yep, let's do peds for 500 because this is a good one. I can't tell y'all how many times I've seen this on an exam. My NCLEX, your NCLEX, her NCLEX. I'm just kidding. But I've seen this question so many times. Well, maybe not this exact question, but the content behind this question. You will see it all the time, and it's super, super, super important. Okay? Jamil! Stop. Hold on. Of course I miss you. Anyway, let's go ahead and do... Wait, y'all said... Oh, I just did pharmacology. That's what that was. All right, so we're doing peds for 500. A child with type 1 diabetes mellitus is brought to the emergency department by the mother, who states that the child has been complaining of abdominal pain and has been lethargic. Diabetic ketoacidosis, or DKA, is diagnosed. All right. So anticipating the plan of care with this now new diagnosis of diabetic ketoacidosis, the nurse prepares to administer which type of intravenous infusion? Nikki is 1985. Hey, well, I'm good. Is it 1, potassium infusion? 2, NPH, insulin infusion? 3, 5% dextrose infusion? Or 4, normal saline infusion? What is our answer? Okay, I'm gonna run it back. So we have a child that has type 1 diabetes. They were complaining of abdominal pain and being lethargic. All right, right away. Whenever you see a type 1 diabetic and complaining of abdominal pain and they've just been lethargic, your mind should immediately go to DKA. And that's exactly what was diagnosed. Okay. So with that being said, anticipating the plan of care for this patient, the nurse prepares to administer which type of intravenous or IV infusion? Is it potassium, NPH insulin, 5% dextrose, or normal saline? What? Nurse Hive said definitely not the K. Please don't give the K. Well, I won't say that, actually. I won't say that. What is our answer? Potassium, NPH insulin, 5% dextrose, or normal saline? What are you going to prepare to give this the type 1 diabetic child who was just diagnosed with being in diabetic ketoacidosis? Potassium, NPH insulin, 5% dextrose, or normal saline? What is our answer? I'm scrolling up, scroll. Miss Trina said, do you have any exams for the study guide? Yes, the ATIT study bundle. All right, so the answer is, y'all ready? Y'all about to be so mad. I'm just kidding. The answer is what is for. What is for? Normal saline infusion. That's what you should prepare to administer. Normal saline via IV infusion. Absolutely. Y'all know why? Who's first going to say what it's for? Everything Ari. Ew. Great job, everything Ari. 500 points on your score. Who else got it? Benta Kib. Wait for it. Ermani, Unknown Beauty. Unknown Beauty just came to serve us. Okay. NC Pink Rose, always serving. Nikki's 1985. It's just EMC. It has to be 4. That's funny. Itsuki baby. But I think 4. Yeah, it's 4. I think it's like glucose. Yes. I love you, Jamil. You're so funny. Absolutely. All right. Dehydration. So, diabetic ketoacidosis. That's a complication of diabetes mellitus that develops when a severe insulin deficiency occurs. All right. Hyperglycemia occurs with diabetic ketoacidosis. All right. I don't know if you've ever personally dealt with a diabetic, but usually one of the main signs that hyperglycemia occurring with the diabetic ketoacidosis, before the abdominal pain or maybe even after, when you check their blood sugar, most of the time when they're in DKA, especially if it's like a little home machine, it just says high, HI, which means like over 600, depending on whatever the threshold is. But super hyperglycemia occurs with diabetic ketoacidosis, okay? And once again, that's from a severe insulin deficiency, all right? Now, the initial step, there's steps involved in resolving DKA, all right? So the initial step in resolving diabetic ketoacidosis is rehydration, which is why normal saline was the answer. All right. Rehydration is the initial step in resolving diabetic ketoacidosis. So normal saline is the initial IV rehydration fluid. Now, I think someone just said it. NPH insulin is never administered by the IV route. They got you with that one. Absolutely. I just scrolled past somebody saying that. Both answers. Somebody just said that. Yep, NC Pink Rose. And I believe only regular insulin can be given IV, not PH. Y'all better write this down. Note all these because these are very important. Okay? NPH insulin is never administered by the IV route. So 2 is out. Okay? Dextrose solutions. Remember, number 3 was 5% dextrose solution. Dextrose solutions are added to the treatment when the blood glucose level decreases to an acceptable level. Remember, that hyperglycemia is already occurring with DKA. You don't want to add even more high sugar, okay? So you're going to eventually have to, especially with the DKA, but once again, that's not going to be the initial thing you do because it's already high, okay? Once again, you're going to do that when the blood glucose level decreases to an acceptable level. Yeah. And then it says IV administered potassium may be required depending on whatever the potassium level is, but that would not be part of the initial treatment. Okay? Oh, thank you. I need to like I'm going to cook. That just me out. All right, Lauren. I'm going to do one more after this one. Regular insulin B. Okay, great. Y'all got that, right? So rehydration. Dextrose may be added at later when the blood glucose levels are acceptable. And then IV potassium may also be required depending on the potassium level. So, how I remembered it, for like DKA, the D would be for dehydration. The K, you may need some potassium. And what was the A? And also maybe dextrose. So you can use that. And that's kind of, I remember, because there's a process that you need to do, but it always starts with rehydration so that you can help with that whole DKA thing. The D stands for dehydration, the K for potassium, and then the A for also whatever else. Okay. I gave those points, right? Okay, great. Let's do one more. That was peds. So let's do mental health. Yep, let's do mental health. Ooh. Okay. Y'all want to do mental health or y'all want to do med surg and kind of stick with the diabetes stuff? Which y'all want to do? I'm gonna let y'all choose. Both for 500 points, but I'm gonna let y'all choose. Y'all want to go to mental health, or do y'all want to stick with med surg and stick with the whole diabetes train that we got going on? Which one? Which one y'all want? Mental, med surg. Everything Ari. She won the last round, so let's go ahead and do med surg. All right, so a client. Fine, I'll do this and then I'll do mental health. Ooh, y'all just get spoiled. Okay, let's do it. A client receives 5 units of insulin. A client receives 5 units of insulin aspart subcutaneously just before eating lunch at 12 o'clock p.m. noon. The nurse should assess the client for a hypoglycemic reaction at which times? Is it 1? Between 1 and 3 p.m. 2, 10 minutes after administration of the insulin. 3, between 4 p.m. and 12 midnight. Or 4, between 8 and 10 p.m. When should you assess the client for a hypoglycemic reaction after giving them 5 units of insulin right before they ate lunch at noon? Okay, just make sure I was right too. Woo-wee. Go ahead and answer. Come on. Is it between 1 and 3, 10 minutes after administration, between 4 p.m. and midnight, or between 8 p.m. and 10 p.m.? What is our answer? All right, so our answer is, what is 1? What is 1? Between 1 and 3 p.m. Question, what kind of insulin is insulin aspart? Insulin aspart is what kind of insulin? Insulin aspart is what kind of insulin? Thank you, Unknown Beauty. It is rapid acting, not short. It is rapid acting insulin. All right, so if you have a rapid acting insulin and you're giving it at 12, its onset, first of all, is going to be in the onset of action is 15 minutes. It's going to peak in 1 to 3 hours. And its duration of action is 3 to 5 hours. Okay. I think last week I posted like a NCLEX farm cheat sheet. And right at the top, I had the insulin stuff. Hold on, let me look for it. It's on my profile, but it's also a part of the Ultimate Nursing School bundle right here. Oh gosh, wait, here we go. All right, y'all remember this? All right. So this remember, it's a rapid acting. Onset 15 minutes, peaks 1 hour, duration 3. Okay. Novolog insulin. Well, remember, insulin aspart is a rapid acting. Okay. So if y'all need a little cheat sheet as far as the insulins, I just want to help y'all with that. Okay. Let me go back to my game. All right. So once again, hypoglycemic reactions are most likely to occur during the peak time. Okay, so remember, it peaks in 1 to 3 hours. So if you're giving it at 12, then I looked at that twice. It's on my profile, my Instagram profile. Once again, hypoglycemic reactions are most likely to occur during peak times of that insulin. And with this being a rapid acting insulin, it peaks in 1 to 3 hours. So if we gave it at 12 o'clock noon, then it's going to peak in 1 to 3 hours, which is going to be 1 to 3 p.m., which is going to be when the hypoglycemic reactions are most likely to occur. Make sense? It is on this page. Awesome. Ooh, period. No slapping. No slapping. All right. So that was adult. Wait, let me see who got that first. I don't think I gave points. It was, I think I saw it was Unknown Beauty. Let me go and make sure. Yes, it was Unknown Beauty. So you got another 500 points added. So you have 1,200 points. All right. So let's go ahead and do the last one, which is going to be mental health. And then we're just going to wrap it up for the night. Now let me scroll back down. Great job. Everything Ari also got it. Itsuki Baby also got it. Niche Buck, Joey Keys, Binta Kib, Blessed One. Happy Nurses Week. Nurse Sasha. Ermani, great job. July. Nurse Tasha. Immaculate Michelle. NC Pink Rose. Fat Red Bow. Blackberry. Mommy. All right, awesome. All right, last one, mental health. A client diagnosed with depression says to the nurse, "Things would be so much better for everyone if I just weren't around." Which response should the nurse make at this time to assess the client's state of mind? 1. You sound very unhappy. Are you thinking of harming yourself? 2. Have you talked to anyone specifically about what is bothering you? 3. Those feelings will go away when your medication really takes effect. Or 4. I know what you mean. Everyone gets that way when they're depressed. All right. Mental health 500. So we have a client diagnosed with depression, and they say to the nurse, "Things would be so much better for everyone if I just weren't around." Which response should the nurse make at this time to assess the client's state of mind? 1. You sound very unhappy. Are you thinking of harming yourself? 2. Have you talked to anyone specifically about what is bothering you? 3. Those feelings will go away when your medication really takes effect. Or 4, I know what you mean. Everyone gets that way when they're depressed. I think all y'all, well, I have some people saying 2 and a lot of people saying 1. Let's see what the answer is. Can we all agree that it's not 4? Can we all agree that it's not 4? What if it was 4? I would have been so pissed. But yes, no. All right, so the answer is, what is 1? You sound very unhappy. Are you thinking of harming yourself? That is the answer. First person to get that is, I think it was Armani. Yep. Great job, Armani. You just got 500 points added, so you are now at 1,000. Great job. Who else got it? Binta Kib, Itsuki Baby, Lauren, Joey Keys, the doll Stacy, NC Pink Rose, July, Blessed One, So Bratty, Angie, Nurse Tasha, Blackberry, It's Just EMC, the doll, I think it said the doll Stacy. Immaculate Michelle. 2 would be a follow-up question or suggestion for therapy. Absolutely. All right, we're going to get into it. All right, so rationale says clients who are depressed may be at a higher risk for suicide. Now, with that statement being things would be so much better for everyone if I weren't around, that is a statement that is hinting suicidal ideations. So when clients make statements like the one I just said, things would be so much better if I just weren't around. It's critical for the nurse specifically to assess suicidal ideation and plan. Okay, so it's almost like a two-step process. You have to almost like restate what they're feeling, and also assess to see if they have a plan for said suicidal ideation. Like, I understand that you are very unhappy. Well, it sounds like you're very unhappy. Are you thinking of harming yourself? So that's that's the best method as far as directly asking them whether they have a specific plan that they're going to carry out, or if they've formed a specific plan. The other options is they either don't address the client's concern or place the client's feelings on hold. Okay? Good night, Lauren. Okay, I'm gonna go look at your story. But yes, so that was yay, awesome. So this was definitely 1. So 2 says, have you talked to anyone specifically about what is bothering you? Even though that is not as bad as 3 or 4, once again, it's not, remember, you got to read the room. You got to read the room, okay? Especially as a nurse, you have to pick up on things. And when people say specific things and trigger words, you know how like in the airport, you can't say bomb? In mental health, you cannot say, things would be better if I just wasn't here. Maybe life would be better if it was just over. Anything that's hinting towards suicide, you got to act on that and take them seriously as if they're going to do it. Now, but like I said, it's a 2-step process. Not only do you have to take them seriously, but you have to assess to make sure they don't have a plan. So you have to ask them just directly. Honestly, the best method is just to be direct, but also therapeutic in your communication, which is a big thing with mental health. Okay, you always want to restate, have things that is question, because you want them to do the talking about their feelings. You don't want to just assume you know everything and just give your opinion. I guess you never want to give your opinion. All right, you kind of, like I said, that therapeutic communication that comes with practice, but you got to know how to like de-escalate and how to get the answers that you need as a nurse, because you know the physician, the provider, whoever, they're going to ask these questions, and you have to be the nurse, be the person to get it from them, still having that that patient nurse relationship so that they can trust you. So you definitely don't want to say those feelings will go away when your medication really takes effect. First of all, the question said nothing about them being on medication, so you can't assume that they're on medication. All right. And then 4, I know what you mean. Everyone gets that way when they're depressed. That's dismissing their feelings, and they probably gonna cuss you out. Bitch, you don't know how I feel. Don't do it. Do not do that. So yes, 1 is the best answer. You sound very unhappy. Are you thinking of harming yourself? Restate, assess to see if they have a plan. Okay. Yep, absolutely. So let's go ahead. That was the last question. Let's go ahead and round up our points. Unknown Beauty was the winner, and Ermani was the 2nd place winner. Unknown Beauty, I know you got everything under the sun. Do you want to donate your prize to the next runner-up? Or do you want to look and see if there's anything on my site that you don't have? So awesome job. So Ermani, am I saying your name right? Because I'm going to be so mad if I'm not. Please let me know I'm saying your name correct. But Ermani, please DM me you too, Unknown Beauty. I already know your stuff, but DM me what you want to do, or just put it here what you want me to do. Oh, she's just here for the practice. All right, so Unknown Beauty, we're going to give your stuff to the next person. So Ermani, DM me your name, email address. Congratulations, you won the Ultimate Nursing School Bundle. If you already have the Ultimate Nursing School Bundle, let me know, because you will then get NCLEX Arcade. Great job. And then who's the next person? Hold on, I'm going to go through my points. Who was the next person? It would have been Everything Ari. Where you at? Where you at? Hold on. Where you at? Hold on. I literally just saw you. But oh, it's Suki baby. You would have been right below Everything Ari. But she oh, there you are. Everything Ari. All right. So Everything Ari, you are also the second runner-up. So if you don't have the Ultimate Nursing School Bundle or NCLEX Arcade, let me know, because that's what you want as well. Yee! So if you're still on here, DM me your name and your email address, and we'll take it from there. Let me write down your actual name just in case you left. All right. So congratulations to Unknown Beauty, Ermani, Everything Ari, and congratulations to everyone that was on the scoreboard. Okay, great. Congratulations to everyone that was on the scoreboard. Like I said, even if you didn't win this week, we do it every week. And as long as you're coming for that practice, you're really winning in the long run. Okay? If you loved these NCLEX Jeopardies and you kind of want to watch the old ones, we have like over 20 in the video vault on the Study Bar community membership. It's a monthly membership, perfect for aspiring nursing students just about to start, students just about to graduate. You just want to take advantage of all the NCLEX things. All right, it's $29.99 a month. You can cancel at any time, or you can do it for the year for $300 and get 2 months for free. However you want to do that. But that is where all our videos go. So all the lives that we've had, they go directly into there. You have access to all the study kits, to all the cheat sheets, and a bunch of exclusive cheat sheets and resources that's not even on my shop or in Instagram. It's exclusively for the membership. So once again, that is Study Bar Community. You can click the link in my bio or go to studybarcommunity.com to enroll. What else? Once again, it is the last day of our Nurses Week celebration. Happy Nurses Week to all my nurses that are on here, either just for the practice or because you're bridging. Happy Nurses Week to you. All my future nurses, this is about to be y'all, and however long it takes y'all to get y'all license, y'all about to be living it up for Nurses Week as well. So today's last deal was the reintroduction. We brought back NCLEX Arcade. Right now it's only, well, before and after tonight, it's only available for the enrolled members of the Study Bar community. So for today only, we brought it back for purchase without being an actual enrolled member. And it's originally for $297. Today it is $59. All right, use code NW59 to get that before it goes back in the vault. So you can, but like I said, it's up to you. You can either, if you want NCLEX Arcade, you can either pay the $59 to have it for forever access, the workbook and the 6 videos, or you can pay $29.99 a month and get the Study Bar community membership and get access to that, plus so much more. So whatever you want to do, whatever your pockets desire. I just want to make sure I'm just telling y'all where to find these resources. Also, this is going to be updated as far as the Jeopardy questions that we just did, all the other ones that we didn't get to do, and the ones if you want to go back and just retake the questions that we did go through, and just to make sure that you really understand the content. It's going to be in the NurseSam app. It's literally called the NurseSam. For Apple phones and Android phones. All right, link is also in bio, so you can download that free app. And when you do download that app and open it, go to NCLEX Prep. First button you'll see will be NCLEX Jeopardy, and you can play the mobile version. So just how I was showing y'all the blue screen, you'll see it on your phones. Okay, it's a mobile version. You get to play the entire 25 questions, and you get 25 new questions every week, which is why we do NCLEX Jeopardy every week. We just don't go over the full 25. Okay, so once again, that is free. If y'all want that practice. I'm taking NCLEX, and what do you recommend? Ultimate Nursing School Bundle, to attend these NCLEX Jeopardies because they're free and it's free practice and it's group studying. You can also join the study bar community because you can access literally everything that I just said, plus all the other resources that we have about passing NCLEX. And I think that's it. Oh yeah, NCLEX Arcade. But once again, that's also available in the study bar community. Or for today only, you can get it by itself. Alrighty, I think I said everything. Can paramedics be a part of the Nurse Bay family? You're a part of my Nurse Bay family. Listen, I loved my paramedics. You're welcome to my family. Absolutely. All right, guys. Thank you so much for joining me. I know that ran super long. What do you recommend for the T's? I'm a pre-nursing student. Join T's Tuesday, which is this, but on Tuesdays and for T's. Get the ATIT study bundle. Yeah, as far as me. And make sure just practice. Because for the T's, it's everything that you already learned in grade school. You just have to practice recalling that stuff and know how to like strategically answer those types of questions. It's literally like SAT, ACT for nursing school. So it's that type of comprehensive reading, math, reading, writing, arithmetic, basically. That's what the T's is. So yes, we have our ATIT's bundle, which includes all the 4 sections. Or you can also come to T's Tuesday where we practice just like this for the ATITs. I know, I was talking a lot. All right, guys. Sex teacher, what? All right, guys. Thank you so much for joining me this week. I will see y'all again Tuesday for T's Tuesday or next Thursday for NCLEX Jeopardy. And if you have not watched the Decision Day finale of Married at First Sight, please go watch it. And then after you watch it, go to my story so we can talk shit. Okay? Love you. Bye.